We're here to talk about quality improvement. I know, what's that got to do with me, right? Well, every job from admin and patient transport to senior management and surgery affects patient care. We all have our part to play. Each one of us finding a way to do our job a little better ultimately improves the quality of care we give. To help this, we've started a Quality Improvement, or QI, programme at Imperial College Healthcare NHS Trust. It's values-based and it's open to everyone. It uses small changes in our everyday work to make big overall improvements over time. QI isn't random though, it's carefully planned, and it's a chance for you to use your ideas to make a difference. More formally, we can say QI is a method for developing, testing and implementing changes so that improvements can be made quickly but in a planned way. So what is quality? At the Trust, we use 5 domains to explain quality. They're the ones used when services are inspected. Care has to be safe, effective, caring, responsive and well led. With lots happening in the NHS and pressures on budgets, it can be tough to think about improving when our working day already feels pretty full. But the point is, we're not talking huge, complex projects. Often, it's the smallest changes that have the biggest impact. Like standardising the way we do things to ensure each step happens, or creating little nudges that transform everyday behaviours. It might be as simple as double-checking our work, learning from mistakes as a team, or avoiding duplication and waste. These changes should be thoughtful, meaningful, and become part of our normal work. And they will help all of us deliver our promise. We learnt a huge amount from staff and patients whilst reviewing our organisational values and promise. A really strong message was that these values should be central to everything we do, not just left on paper. The QI programme will be one really powerful way of achieving this. QI is sometimes called an improvement science, but we also like to think it's an art. The art of engagement, listening, building relationships and supporting each other to deliver change. An art with patience at its heart. So how do we actually make things better in practice? Quality improvement first started in manufacturing years ago and moved into healthcare more recently, so we can learn from the experience of other organisations. One good example is the Institute for Health Improvement's model for improvement. This model basically says that when we're thinking about improvement, we should ask 3 questions. What are we trying to accomplish? How will we know that a change is an improvement? What changes can we make that will result in an improvement? It's something that might be familiar, but perhaps without its formal name. Essentially, we make a plan to do something, we try it out, see what happens, and then act on the results to tweak things the next time round. The trick is to keep it rolling to build up lots of small changes that add together to make the big difference. The cumulative effect can be really significant and benefit patients across the organisation and beyond. And it's your ideas that can make this happen. We want to support everyone to get involved. There are 10,000 people working for the Trust, and each of us can contribute to developing a culture of continuous improvement. To achieve this, we all need to be aware of this ambition and have access to support. Moving forward, there will be a strong mix of QI learning sessions available. Many will be team-based and will give the opportunity to work on real improvement projects during the sessions. They will be an amazing opportunity to come together with different people, from data specialists and designers to communications experts and patients, to create really inspiring change. And there's a QI hub to help. They're a friendly bunch of people who have a range of skills and different clinical and non-clinical backgrounds. They can give advice on starting a project, help get the views of others, including patients, help us determine whether an improvement has happened, and help to share and sustain improvements so that they really stick. To find out more, check out training opportunities or get started with an improvement